Assalamu alaikum wa rahmatullah. I am Dr. Ahmed D. Abdulwahab. I am a diagnostic and interventional radiologist. Today we will present a case about a female patient, 32 years old, presented with seizures. Brain MRI was requested, and as you can see here, as I think you know by now, this is an axial T2weighted images. You can see the CSF here is bright, and you can see the eye globes are bright, indicating a T2weighted axial MRI images. And you can see here, obviously, there is increased T2 signal intensity taking the shape of the white matter and extending in between the cortical gyri, indicating vasogenic edema. And you can see that within the lesion there are some hyperintense, within the edema there are some hyperintense lesions, mainly in the right cerebral hemisphere. And you can see another focus in the right temporal lobe here. And let's see the T1 weighted images. T1 weighted images showing this site of the vasogenic edema, and you can notice this is a T1 just by looking at the CSF within the ventricle. It is hypointense, and the gray matter is hypointense, indicating it is T1 weighted axial image. Now let's go to the FLAIR image. FLAIR image shows also vasogenic edema involving the mainly the white matter. Okay, and you can see some foci within it that appear suppressed on the FLAIR images. And you can say this is an edema just by not every this is something I want everyone to know. Not every white matter hyperintensity on T2 images means edema. It is edema only when it's causing mass effect. You can see the cortical sulci here are effaced, they are gone, they are swollen compared to the other side. The other side, there is a very well demonstrated cortical sulci, and you can see here it's effaced. You can see the ventricle here is compressed compared to the other one, and you can see even some minimal midline shift to the other side, indicating that this is a genuine edema. Sometimes you can see T2 hyperintensity within the white matter that is not causing mass effect, and this indicates not edema, indicates some sort of demyelination or inflammatory changes, not necessarily edema. So not every white matter hyperintensity means there is edema. Sometimes it's due to demyelination. You need to look for causes that cause demyelination of the brain without edema. Edema is seen only in cases of malignancy, of metastasis, of inflammatory changes, post, for example, abscess formation, and things like that. So let's go to the sagittal images. You can see in the sagittal image, this is the corpus callosum. It looks good. The brainstem looks good. And in the cerebral hemisphere, you can see the white matter edema, and you can see lesions within the center of the edema. And the thing is to notice here is that the amount of the edema is disproportional to the size of the lesion. The lesion is small. It's maybe, I don't know, 1 centimeter, 8 millimeter in diameter, but the edema is markedly much more. So this is one of the things to keep in mind, that the edema is disproportionate to the size of the lesions. So what else do we need to do? And of course, before I forget, there is a retention cyst within the maxillary sinus. It's of no clinical significance here. What do we need to do to make a proper imaging study here? Of course, we need to give contrast to see whether there is a contrast enhancement. And you can see this is a T1 weighted image. The CSF is black, the gray matter is dark, indicating this is an axial T1 weighted image. However, you can see the the cerebral venous sinuses are white, and the cortical veins are white, indicating this is a post-contrast image. And you can see these lesions are showing peripheral enhancement with some central nodularity here, here, and here, another one, and another one possibly here. And you can see there are multiple ring enhanced lesions with central nodularity. So tell me, what do you think, and write it in the comments. And don't forget to join our Telegram group. The link will be in the first comment. You just click it and you will be added to our Telegram group for much more discussions and interesting things. Thank you very much. See you tomorrow.